Sounds like a movie, sounds like a song, the pandemic and beyond. Sounds like a movie and a beautiful song.
Hi, my name is Eleanor O'Keeffe. Welcome to this podcast from the Pandemic and Beyond, a project funded by the Arts and Humanities Research Council at the University of Exeter to show how research in the arts and humanities is helping us to live through, make sense of, and hopefully recover from COVID-19 pandemic. Today, I'm joined by Dr Sarah Gong from the School of Media, Communication Sociology at the University of Leicester. She's been leading on a project investigating the factors and determinants of Chinese communities' engagement with the UK vaccination programme, a project that has involved considerable participation and input from community partners. Joining us too to reflect on some of the co-design elements of the research is Circle Steele, Chief Officer of the Wai Yin Society, an organisation led by Chinese women which provides education and social welfare services to minority communities in the northwest of England. So, Sarah, could we start with a bit about your research background and the work that you've done before the pandemic with community partners of Chinese communities in England?
Yes, of course. And thanks for inviting us, Ellie. So my research interest lies broadly in the area of health communication. I've worked on health communication on the sort of public level. So we investigated media-mediated health-related messages and how, for example, health risks are represented on news media and also in advertising. And I've also worked with health communication on individual levels and interpersonal levels. So in this aspect, we look at how individuals and organizations seek and evaluate health information in various contexts, including, for example, maternity and child health, smoking cessation and vaping, and also lately COVID vaccine hesitancy. So in the past years, I have developed a research interest in health communication for ethnic minority or migrant populations, largely from my own experience of being a Chinese pregnant woman a few years ago, navigating vast information about pregnancy, about baby care in two languages, English and Chinese. So after I returned from my maternity leave, I started researching this area of pregnancy and Chinese women, especially in the UK context. And I realized that there was very little literature about this group of women. So I reached out to Wai Yin Circle and I requested her input and also requested some assistance in participant recruitment for my project, which was luckily funded by the Wellcome Trust. So we did this research project together and we've been working together ever since. But in terms of, why we need to research the Chinese community, again, it is quite important. I think it's an overlooked topic in health literacy, scholarship, in health communication, also in probably health services as well. Because as far as I know, this Chinese population is quite a large population in the UK. Based on the 2011 census, there were 400,000 Chinese people in the UK, but I think the number has grown significantly, although we're still waiting for the 2021 census data. I think on this note, I'll pass on to my partner, Circle, who knows much more about the Chinese community in the UK, and perhaps she could also introduce her organization to us a little bit as well.
Thank you, Sarah. So I've earlier talked about Wai Yin is an original setup for the Chinese women suffer domestic abuse. So we support women first, and then we expanded to women got children, young people, and older people. So we expanded to like a community service. And then about last 8 years, we also developed to serve quite wide range different minority. So when actually COVID hit, the community have a lot of demand facing by ourselves to deal with some of the equality issues, healthcare issue, loneliness, isolation, mental health, domestic abuse. So our frontline worker, our door never stop, our kitchen, cooking never stop, deliver to the community. And one thing, when a time go by, the vaccination come along, that's why we're talking to our community member. And a lot of questions come out. Of course, at the center, a lot anxiety, uncertainty. So we say, how about we look at something can be collaboration to do a proposal. Now, 6 months, very short time, and then we have to deal with a lot of emergency thing, turn around. Then we have our worker and also Sarah's workers to take part to the vaccination hesitancy program to work along, decide the question, talking to the youth. That's why the relationship and then the methodology work, because I'm very emphasized about community engagement.
That's amazing, because it's really how the design for the research is developing in dialogue, isn't it? In terms of your knowledge and your connection to community networks, your relationship to Sarah, and how you're able to bring these elements together to form a research design, which is fantastic.
But also for Sarah, this time is very different from what my experience before, because we're able to have share some of the resources from to distribute to the volunteer organization. So that is a good example. I think the rest of the country, if they want to engage volunteer organization, should be like that.
And Sarah, because you had those connections in place, it sounds like you were really able to hit the ground running in responding so quickly to the COVID challenges.
Yeah, absolutely. I think without that kind of relationship, we wouldn't have been able to do our project in a very short space of time. But yeah, I mean, Circle was absolutely right. The origin of this study, I would say, actually starts from Circle, from what she told me about this webinar that they organize on Zoom. So when she told me that, people have concern, worries about vaccines, and I thought, okay, actually, this is something we should look into. And then I looked into the literature and realized that there are some publications about the Chinese communities, although very few, saying that Chinese communities, the acceptance rate, was quite low. It was probably between 50 to 60%, and the rest of the population was quite vaccine hesitant. And of course, vaccine hesitance is always a health risk. But in the context of COVID, we needed that wide coverage of vaccine across society, across populations, across groups, to be able to achieve this high level of protection. So we decided to, carry out the research then. And of course, we worked together on the research application and all of this research ideas in terms of the objectives, what we wanted to investigate, the key things, for example, people's factors, their determinants, facilitators and barriers of vaccine uptake. These questions are all shaped by Circle and her team, and especially the research design. Of course, we can talk about that a bit later. Again, we really took on board their input. We wanted to have a working group which was formed by 8 very active Chinese community members. They really advised us on a lot of things. For example, what kind of intervention you wanted to design, the form, the content, the channels where you wanted to disseminate them. And also throughout the project, we had so many meetings with them. They gave us ongoing feedback on our design of our interventions rather than just one-off. Yeah, exactly. I think that's really, really important. So really, the research was conducted under their advice every step of the way. So I think that's why probably it worked really very smoothly. And yeah, I'm really just very grateful for their help.
And then the working group is actually people with lived experience. So bring it a lot added value for the conversation to develop. They feel engaged, they feel they're part of it. Because sometimes when they decide the question, if you don't consult some of the group, it's just they weren't able to answer. Some of the language may be very academic. So it's good like a pilot. They will read through your question. And then what kind of wording would be people will understand.
I think this is really showing what you were talking about, that inclusive research all the way through a project, from its design stage feeding into its methodology. At every point, this dialogue that's creating the research agenda itself, which sounds absolutely amazing, and predicated, obviously, the whole success of the project in many ways, in terms of increasing and guaranteeing that level of trust that you were talking about, for people to talk to researchers, to engage with researchers on these issues, which are very difficult issues. I think you can't just walk up to people on the street and say, what's your vaccine attitude? It's difficult. These are sensitive subjects.
Yes, very sensitive. And as English is the second language, what majority are used either the Cantonese or Mandarin speaking. They won't come to authority say, I want to join your research, because all this interpreter language barrier. Seems to be an advocate voice. The community voice got to be heard, okay, but in different way, in a different engagement way. Sometimes with Sarah's team can understand Mandarin. Sometimes some of the researchers, they don't. They need to provide interpreter. So that got to be resources, because I'm sure the community is very diverse with many, many multicultural language in the city, which is wonderful. So they must make sure when the mindset decide a research proposal, inclusive.
So should we go on to the research design, having seen the need for the project and having thought about the key barriers and the propositions that you were kind of testing through the research, how did you envisage getting at these very tricky issues regarding vaccine hesitancy and really being able to unpick these.
Yeah, so again, this is really a sort of co-design effort. I mean, when I conducted the literature review, I knew the existing literature, a lot of published studies were based on rapid survey research. I mean, this method is very useful, especially given that kind of context. You need data quickly to understand broad trend and patterns. It was also very economical as well to be able to collect a large sample. But they are limited in the way that they couldn't provide us with a lot of insights into why the community is hesitant, what are the concerns, what are the barriers and the facilitators. So we decided to go down a different route. So we decided to go with a more in-depth method. So at the point that we talk about interviews or, focus groups. But again, we spoke to Circle's team, and it told us that they already have existing structure that could really facilitate these kind of in-depth methods, especially focus groups, because Circle's team already organized, for example, cancer support groups, organized women's groups, breastfeeding groups, and also mental health groups. So they already have this mechanism to meet with their members, users regularly through Zoom meeting. But I think before COVID, they were meeting face-to-face, right? Probably during COVID, they changed to online. But that also helped us tremendously because, again, they put this foundation down for us to conduct our research, electronically online. And again, their existing structure with people with similar kind of background, coming together, they know each other, they're more comfortable with disclosing information and sharing, of course, building that rapport among the groups in those settings. So that's the kind of main method, focus group which we use to collect empirical data. But the working group was also very, very instrumental. As we said, they really helped a lot in terms of getting us the feedback. Members of the working group were very, very committed. Almost everyone showed up in our meetings. We had loads of meetings, and also before every meeting, especially towards the end of the project, we give them our materials to look at. So our interventions, which are audiovisual kind of materials, for example, animations, film or rap, music, poetry, things like this. They have to go through a lot of them and then provide feedback and write down their notes. So really a lot of effort from the community members, from the working group. And in terms of later implementation of our interventions, once they have been designed, the working group is again also very helpful for promoting them with their community members. So they introduced our materials to their friends and family and through their social network site as well. And this is still ongoing. So what we plan to do is that, maybe a few months down the line, we will try to again collect feedback from the community and try to evaluate how impactful our interventions are.
Yeah, I think that if they do the research report, it's got to be meaningful. They don't want the report put in the bookshelf, okay? The report have an impact to the community. It's live document. So that's why Sarah continue to develop some of the innovative approach with some of the community group they already established. The investment always there. Don't waste the investment. We carry on some of the good work. So some of the long-term strategy got to be research council or whatever. They have to think of some of the long-term strategy to support this.
Yeah, I think you're right. Obviously, Sarah's doing a fantastic job of being able to resource those dialogues and conversations through different funding streams, but that's a lot to balance.
Yeah, I think we're really lucky to be able to have that resources. I'm really, really fortunate.
But I love the description of this report of a project's report being a live document. I think that you're absolutely right that that's what people should and have to aim for in terms of COVID impact research. It has to be live. It has to be something that causes momentum and energy and change, rather than, as you said, going on a bookshelf, which is not where you want your report to go.
So that's one thing we kept the learning. I think before COVID, a lot of research done by whatever report. Okay, you can one report, two, but put that on your table. But if this is very live experience and live document, they got to have an impact, because we're still in the uncertainty period. Still a lot unknown happening.
So could you explain a little bit then about your findings in terms of understanding vaccine uptake and vaccine hesitancy amongst Chinese communities?
Yeah, sure. I mean, that's the first question we ask. What are your concerns about the vaccines? If you have worries, if you're hesitant about vaccines, they have some shared concerns with the rest of society. For example, they worry about side effects. They worry about, health risks. For example, blood clots. That's something we knew that could be associated with AZ vaccine, and also myocarditis, which is associated with Pfizer vaccine. But in addition to this kind of common concerns, the Chinese communities also have their specific concerns. So for instance, their worries about side effects are often articulated in relation to other family members. So older members would tell us that I worry about developing side effects because I don't want to become a burden to my adult child. And then middle-aged people would say, I don't want to become ill, so I can't go to work, and I can't afford for my family. So this kind of articulation is also very often seen in multi-generation kind of households. And then they have specific social media misinformation. So among the Chinese community, we often hear the claim that vaccines can cause infertility. The vaccines can cause facial paralysis. That's very specific in the Chinese community. I think that's a lot of information being circulated on Chinese social media. And then also we heard from older members of the community telling us that if they have existing health conditions such as diabetes or high blood pressure, then they think they are too weak to take the vaccines. And then we also heard from new arrivals, new immigrants. They told us that they are unfamiliar with the NHS system, so they don't know where to access the vaccines. And then we also have people telling us that if I am a homebody, if I stay home all the time, if I socially isolate from the rest of the world, that probably provides enough protection to me, so I don't need to take the vaccines. And then we have Chinese international students, which is a subgroup we investigated. They tell us that they don't want the vaccines because the vaccine will give them antibody. But that poses a problem for them going back to China, because the Chinese government requires additional antibody tests to determine whether the antibody comes from COVID infection or from vaccines. So that gives them additional financial burden to do the test to be able to go back to China. So they don't want the vaccines while they're here studying in the UK. So these are the kind of the specific concerns from the Chinese communities. So based on that, we of course asked them, what can help you, decide to take the vaccine to help with the vaccine uptake. So people talk about being able to go back to work or take care of their family. These are the kind of concerns. And then people also told us that if they are able to speak to a doctor in their own language, that would help them. They would give them confidence to think about taking the vaccines. They also say that if they hear a positive experience of their social network, their family or friends safely taking the vaccines, then they'll be happy to consider it. And some older members of the community, they were very interesting. They said, well, the vaccination is a good social cause. It's a collective goal that will restore normality back to the society. So we are happy to take the vaccine just to help the society to go back to normal. And that's right after AZ vaccine was linked to some, blood clotting issue. So the older members of the community almost saying, we are willing to take the risk if we can help the society to go back to normal. And for the younger demographics, again, they say, if they can go back to normality, resume their social life, going to pubs, restaurants, bars, be able to travel internationally, they're happy to take the vaccines. Mm-hmm. So based on all of this information we collected from our empirical data, then we designed all of that vaccine community interventions.
Could you tell us a little bit about the kinds of interventions that you ended up developing for the research focus groups?
Yeah, sure. So the interventions that we designed include a short film of vaccination stories. So at the beginning, we thought we'd just do one story and, with a lot of this kind of emotional appeals to the public saying, it's important for you to take the vaccine. But after we've spoken to our focus group participants, we realized that actually age is a quite important variable. So because of age groups, you have different concerns about vaccination. So eventually we designed 3 stories from 3 community members. The first one is a retired Chinese medicine practitioner in his early 70s. And then the second person is a Chinese restaurant owner, a mom of 2 in her 40s. And then the third person is a Chinese international student in her 20s. So we filmed all 3 members and their concern and how they decided from maybe at the beginning, they're hesitant of the vaccines and eventually decided to take the vaccines. The second one is 4 short animations about the vaccines. So each animation is about 1 minute long. We make it very, very short, kind of bite-sized, digestible for especially the younger, demographics. So the first one is about the types of vaccines, and the second one is about access. How do you access vaccines? And the third one is about possible side effects of vaccines. And the fourth one is about some of the misinformation, disinformation about the vaccines. And the third element is recorded interviews with Chinese-speaking GPs. So we went into the Valence Center, which is a GP center in Manchester, and we filmed interviews with 2 Chinese GPs. And there, again, they talked about the vaccine, some of the vaccine-related facts, and then debunked some of the misinformation and myths about vaccines. And the fourth one, we had a project interview with a community radio station. And for that radio station, we sort of, had a conversation just like this one with them about the process of research. And we also recorded a poetry recital and also a rap for their listeners. Again, the second element, rap, is something we didn't plan originally, because we thought maybe the community radios are only for kind of elderly, members of Chinese community, and then people who are probably illiterate. But after we spoke to the community members, we know that actually a lot of young Chinese demographics are using the community radio stations. Some of the young rappers actually go on there and do their programs there. So we decided we'd do the same thing. Let's just do something for the younger age groups as well. And finally, we also designed an app. The app has a QR code, so when people scan the QR code, they can download the app. And in the app, we have integrated all of these communicative intervention elements, so they can basically see everything at the same place. But what's also very important is that we have a built-in survey function in the app. So eventually, I think we would like to use this app to collect user feedback about these interventions and try to collect it that way. So these are the things we designed so far.
But that sounds incredible. That's a lot of creative work that's responding to these findings that are coming out of your analysis. It's the sort of symbiotic nature of all of this. And Circle, your ear is very close to the ground with the Chinese communities. Were you surprised by any of the research that was coming out about reasons for vaccine hesitancy, considering the complexity of some of these issues and how they're all tied together? Or was it a kind of, oh yes, moment, I've heard this, these are the conversations I've been having with people?
Yeah, the majority I know, but only thing when you talk about the international student flying back to China, that part, I wasn't aware, because when we pull out the Chinatown, we found the uptake very low for the young people in the city center. So we talked to the NHS, as maybe we set up the Chinatown vaccination bus, no appointment. We try to make sure that undocumented people can access vaccination, so no immigration check. So we're talking through that part at that time. So we try to get the mainland China student, but why young people, they're not taking? I heard some of the reason from Sarah. So we try to do a big promotion. A lot of people queuing up. A lot of people coming ask a question. Some was quite a lot of students. And also we are able to reach some of the undocumented people. Was there no immigration? They really come up different place travel to do the vaccine. What I also heard the other story interesting is that because some of the population coming through at that time, some is from Hong Kong, they say they don't trust the Hong Kong vaccine. So they come over looking for the bus and then we're queuing up to do it. Now, the other group I heard about from local here, they're looking for the China vaccine, which they say UK doesn't do it.
It's very difficult, isn't it, for people? I think the whole thing is complex, isn't it? But in terms of people who have to navigate borders, the failures of international cooperation and solidarity with regards to the things like the COVID vaccine, how each nation has followed a certain path, and that becomes so difficult for people who are always crossing borders or who are connected to other countries through their family and through their culture.
Yeah, for us, it's very simple, very scientific. But when the culture causing the border country mix up, and then things, they will become more complex. So I say, when you engage community, they can hear more from their side, the story, and then the trust already there. So you easy to, with university and popular research, get more insight, more data. to validate our information as well. And then as time goes by, developing the research model, the method we work, I'm able to share with the health research authority. In that model, I think that's the best model. We're able to share the learning, knowledge exchange.
Yeah, I think what you said, Ellie, you said complex, that's the word to actually summarize everything. So in terms of even our research participants, it's really quite complex, although I was trying to present our findings in a very simplistic way. But a lot of factors are often multi-layered and intersecting with a lot of background issues in terms of how long they have been in the UK, their age, their socioeconomic backgrounds. So it's all very complex. So for instance, when Circle was talking about trust, so we talk about people from different areas. So we have people who are from Hong Kong, who have been in the UK for a long period of time. So their trust is interesting. I mean, we heard from our community members that they trust the UK government, they trust the AstraZeneca vaccine because they trust Oxford University, who is the partner in producing this vaccine. Therefore, they take the vaccine. But at the same time, we also have people who come from mainland China who do not trust the UK government. They do not trust the UK government in the sense that they don't think the government has done enough to protect people in promoting PPE, in promoting facial masks, especially because at the beginning we were told that facial masks are not helpful, so don't wear them. But later on, of course, this recommendation was changed. So people from different area, of course, they are exposed to certain media. So for instance, a lot of Chinese mainlanders are exposed to Chinese media, mainland media. People from Hong Kong, they probably consume more Hong Kong-based, Chinese media. So get all sorts of different information, of course, coming with all kinds of bias and all kinds of prejudices as well. What I also learned in this study is that the Chinese community itself is very diverse, as Circle, emphasized to us. So we're actually designing the interventions. We try to cater for the needs of different small groups within the Chinese communities. It's really hard to be able to make everyone happy, basically.
Yeah. So should we move to those recommendations that you've mentioned, and not only the knowledge, but how this approach should be factored in for the future? How can we make the most of it?
Yeah, absolutely. I think in terms of this specific vaccine project, we're definitely going to carry on implementing the interventions with our community, because it is absolutely crucial to work with them to benefit from their vast experience, especially about sort of locally rooted knowledge, best practice, what actually works on the ground with the communities. So I think that's really, really important. And also not to sort of treat them as a one-off kind of data collection tool. That's, I think, sometimes a lot of research does, not because they want to, but because of the limited sort of resources. But we had opportunity to work with Circle's organization for a longer period of time, from the inception of the research, the design of the research method, the implementation of our impact, and then maybe in the future to evaluate our impact as well. So really kind of a long process, throughout the project. And also I think in terms of working with the topic of ethnic minority health, especially in relation to the Chinese community. I think although COVID might be over, especially in the eye of the government, but I think a lot of issues that we undercover, we sort of identified from this project, and even the project that we did years ago on the Chinese pregnant women and health communication project funded by Wellcome Trust. So for example, in this project, people tell us that, I rely on family or friends to look after me, or if I stay home and socially isolate. So these kind of comments all reflect the sense of social isolation, vulnerability socially, and also sometimes economic vulnerability as well. People have to work because they have to open the restaurant or Chinese supermarket to be able to have an income and to provide for their family. So this kind of vulnerability is still there, although they are articulated through different health problems. In this case is COVID, but in the previous project, it was from pregnancy and maternity care. So I think be able to help with kind of social change, wider social inclusion, equality and diversity, we should keep working in a wider topic of ethnic minority, equality, inclusion, social justice. I think that's definitely a research topic to pursue in the future. And just slightly sort of outside of this topic, we're working with other ethnic minority groups, including the South Asian groups and also Black Caribbean groups. We're trying to kind of scale up our interventions. I know not all our interventions will be relevant to them, but at least I think the animations, the short animations, which contain a lot of factual information about the vaccines, we can try to culturally, appropriately kind of translate them into other languages perhaps, and make them available to other minority groups. And then the final recommendation I would like to mention is that the area I'm in, health communication research, it always has a strong element of real life application. And for us, it is about translating our research findings into meaningful impacts. But unfortunately, impact doesn't happen overnight. The subject of media and communication, sort of our media effect and also audience research theories tell us that you can't just show a video clip to people and expect them to change their health behavior or even intentions. It takes years to form and shape and scaffolding their understanding attitudes to be able to make meaningful changes. So I think it's really important that we maintain our research focus in this area, and if possible, to have sort of slightly longer support of our research, because work with partners like Circle's organization, we do need a long time to get to know each other's work and be able to work together for sort of months, years, even decades to make real important social changes.
It really has shown the importance of these longer term partnerships in being able to respond so effectively to these huge shocks such as COVID. If you hadn't had those relationships in place already and developed already and in ongoing discussions, we wouldn't have all this knowledge. So
but I think from this whole COVID experience, the partnership, the solidarity, I see is a big thing for me, not just only Chinese community, across different diverse community. And even now, we never finish COVID because people affected by the COVID. We have seen people lost bereavement and people lose job, people have long COVID, okay? And then a lot of uncertainties lie around because the economic cost of living. I heard some people already coming to our center and say things too expensive, they can't afford now, okay? So because we give a food parcel, different culturally issue, but we have a lot community partner work together. The solidarity, we help each other. Like Wai Yin Chinese community, we also have a Polish community, Bangladesh, African, Caribbean. Jurists will come together to do best we can for our user mental health chaotic. We have specific counseling service for them during the COVID. Again, but because they can't access NHS. So during that time, we all the community come together to fight. Actually, we are fighting our provision. And then the knowledge exchange, the community learning experience, we're able to disseminate whatever platform we can, like this group, this forum, this authority, nationally. We go to the lecture with different university student classroom or some research fellow when they decide the research and the mindset, how the partners build longer sustainable relationship. Yes. That is got to be a long-term commitment. That is important actually. So we're still campaigning. We make change actually.
Thank you very much to the both of you for joining me today. It's been fascinating to hear about your research. The Pandemic and Beyond team is Pascal Abisher, Sarah Hartley, Victoria Tischler, Des Fitzgerald, Karen Gray, Benedict Morrison, Garth Davies, and me, Ellie O'Keeffe. Our podcast editor is Olivia Rees. The music was written and recorded by Ronald Amanze. To get updates on the project, find out more about the latest research and access our other episodes of the series, you can find everything you need on our website, pandemicandbeyond.exeter.act.uk, or you can follow us on Twitter at pandemicbeyond.
Everyone loves a box of smiles, the pandemic and beyond. Dementia Diaries. Sounds like a movie, sounds like a song. La 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 la.